So my tip for you is if you're selecting a preventive medication, I try to match comorbidities and give people kind of a 2-for-1 approach. So if you've got hypertension, you can try beta blockers, candesartan or lisinopril. These are ones that'll help with migraines and hypertension. If they're depressed or anxiety, venlafaxine or mirtazapine are good choices. And I find like it's off-label use, of course, but even low doses, like 75 milligrams that are not actually antidepressant level, can have a good impact on headaches. Also works well for things like vertigo and nonspecific dizziness when you've ruled out other causes. And so it can be quite helpful. Magnesium, I also throw in at the same time for vertigo and disequilibrium. It tends to have a significant effect in my practice, and I often pair it with venlafaxine. For our patients with bipolar affective disorder, because migraine does occur in this population at a higher rate, some mood stabilizers can be useful as a 2-for-1, like Topamax or valproic acid. And so you can also, if you're uncomfortable with these medicines, pen a letter to your friendly psychiatrist who's working with them. Fibromyalgia and other neuropathic pain types of central sensitization may respond to duloxetine, venlafaxine, or tricyclics. And if they're having particular insomnia, my preference for insomnia is to start with sleep hygiene and not with medications. However, if they're really in crisis, sometimes a little sprinkle of amitriptyline or nortriptyline might help them, at bedtime, both with headaches and with sleep, and just get them back into the regular biorhythm. And then you can wean it away after 6 months to 9 months. If they're having a lot of medication side effects, we all have those patients that say, I'm sensitive to every medicine, and I don't believe in multiple chemical sensitivity, but I believe people can be very sensitive to internal sensations. And I think the good ones are the ones that maybe, are not systemically absorbed, like Botox. And so that's an easier sell for them. Or the CGRP monoclonal antibodies, where we have large trials that show that they don't have a lot of side effects.